Dr. Jeff Mason, orthopedic surgeon from Everett Bone and Joint, joins us in this first segment. We were just talking off the air, and maybe we'll ask the question again. I wanted to know, Jeff, as a surgeon, you don't do surgery every single day. It's once a week, right?
Typically once a week, and then there's a significant trickle of cases other days, but I have 1 day a week that I devote to surgery.
And surgery has changed significantly over the last 10, 15 years because probably the majority of your cases are done in an ambulatory surgery center where the patient drives up and leaves from that surgery center, and no overnight stays anymore, hardly.
Absolutely. Overnight stays are total joint replacements, major spine surgery, that kind of thing. I mean, there are even certain instances where you can have small joint replacements or even total joint replacements that are in an ambulatory setting. It's not done very commonly, but it's done on a regular basis. I
mean, it's nice for communication in your entire staff because you're working with your same surgical team Monday through Friday in your surgery center. So familiar faces, everybody gets to know kind of the flow and customs and all that stuff.
Everybody's on the same page. You have the same people doing only orthopedic surgery. You get to work with them. If you find that there's something that someone does well, you can have them teach the other people. If there's something that someone does poorly, you can get them up to speed. It works very well.
Yeah, absolutely.
Okay, and so I'll ask my other question I asked off the air. What's the longest surgery you take part in?
Well, I don't do total joint replacements anymore, so typically almost anything I'm doing is done within a couple hours at the most from what surgeons call skin-to-skin time.
And what's neat about Dr. Mason's process and having an ambulatory surgery center is the patient actually shows up at the surgery center at 7:30, gets prepped, and is home by 1 o'clock sometimes.
Oh, certainly.
Yeah. And every patient wants to go home, right?
Oh, absolutely. Nobody wants to be in the hospital if you don't have to be.
Right. It's the patients are much happier, and I think when a patient's happier, particularly post-operative and at home, I mean, I think their recovery time's a little better.
Oh, it absolutely is, especially in the short term. And being in hospitals is very disorienting. I mean, even people who absolutely need to be there, there's been lots of work done in the last 10 to 20 years for patients who are hospitalized and the psychiatric issues that develop even in people who are completely normal people, the disorientation, the medications that are necessary. It's a significant issue to try to control and limit this.
I'll go ahead, Maury.
I was just going to ask, isn't it the case nowadays that you're up and walking a lot quicker than you were years ago when you have a surgery?
Absolutely. A lot of the immobilization that used to be done, say, 20 and 30 years ago, in some cases it was unnecessary and it was a bad idea. In other cases, we've developed techniques and better means of fixation so that what was not possible then is routine now.
And part of the advancement is really technology, but also equipment, because in today's world, so much of the surgery is done minimally invasively or through the scope. I mean, you pretty much scope every joint today.
Yeah, absolutely.
And so what kind of technology, how do you guys stay updated? I mean, in your surgery center with equipment, I mean, do you have sales reps or going to courses?
Yeah, you have reps there whenever you want them, and not only are we required to have a lot of continuing medical education, but also you can go to courses where you even don't get continuing medical education credits, but you will work with cadavers and work with specific devices, specific types of equipment. So you can have education that's extremely hands-on, that's not at all theoretical. You say, gee, if I were doing this case in my surgery center, what exactly would I do? Well, now I'm going to do it on a patient who I can't irritate, injure, or otherwise damage. So.
Yeah, always advancing the technology.
That is
cutting edge. No pun intended. Sorry about that.
Yeah, cutting edge.
It's fine. It's not even a pun.
Yeah, that's amazing.